Good afternoon, everyone. I will be kicking off today's presentation. As mentioned, my name is Gladys Carrillo, and I work with the National Center for Farmworker Health. For those that aren't familiar with our organization, we are a nonprofit whose mission is to improve the health of farmworker families. A big part of our initiative is the Ag Worker Access Campaign. This campaign was launched in 2015 as a joint effort with the National Association of Community Health Centers. We, along with other health center staff and farm worker advocates, knew that more could be done to increase access to quality health care for America's farm workers and their families. The result was the Ag Worker Access Campaign, and the goal is to serve over 2 million farm workers across the country. Over the years, we have seen a steady increase in the number of farm workers served across health centers in the United States, with the most recent UDS data showing that over 1 million agricultural workers were served in 2021. We hope that you will join this initiative. But why is access to healthcare so important? And what does it have to do with our discussion about violence today? Access to healthcare impacts a patient's overall wellness. The World Health Organization defines health as the state of complete physical, mental, and social well-being, not just the absence of disease or illness. So if a patient is not able to receive care to address any of their physical, mental, or social needs, their health is jeopardized along with the health of their families. Health includes safety, physical safety, emotional safety, psychological safety. The health impacts of domestic violence can vary and actually affect any of these areas in the short or long term. In the short term, health injuries and related problems are well documented for victims of domestic violence. They may suffer from chronic pain, gastrointestinal disorders, psychosomatic symptoms, and eating problems. In the long term, the effects have been seen as chronic illness, substance use, and mental health issues, including suicide and other negative outcomes impacting adulthood. So in order for a patient to be healthy, all the needs of their life need to be met physically, mentally, and emotionally. In today's presentation, we will touch on the impact of violence, including intimate partner violence and human trafficking, and how those impact patient populations, including farm workers. Violence is a serious public health problem in the United States and has had a profound impact on lifelong health, opportunity, and well-being. It affects all different patient populations, including farm workers and the Hispanic Latino community. And although we know that this issue affects all patients, unfortunately, little data is available specifically about how violence impacts farm worker populations, even if they do identify as Hispanic and are from Mexico or other Latin American countries. One recent study estimates that 1 in 3 women between the ages of 15 and 49 have suffered physical or sexual violence at the hands of an intimate partner. Specifically among Mexican women, it is estimated that 15 to 70% have experienced physical or sexual abuse in their lifetime. Aside from intimate partner violence, there are other types of violence that a patient may experience, including domestic or family violence, sexual violence and exploitation, and human trafficking or labor exploitation. However, we know farm workers may be at higher risk for violent incidents, given agriculture is ranked one of the 3 most dangerous occupations in the nation and had the highest number of reported labor trafficking cases in the United States in 2015. Immigrant workers are often vulnerable to labor trafficking because an employer can control the movement of the worker through threats, physical abuse, debt bondage, or other means. Here's a quick slide with demographics about farm workers, so you can have an idea of the type of patient that this might include and the type of specific demographic information that they have related to their lifestyle. So most farm workers are about 40 years of age or younger. Most are identify as male, and as indicated earlier, a majority identify as Hispanic, and most of them are of Mexican origin. Over half are married and have children that earn about $30,000 a year or less, with ninth grade being their average level of education, and about 77 report Spanish as their primary care language. Now, the main statistic that I do want to point out from this slide is that about 70% access care in the last 2 years. Now, most of you might think that that's actually a high percentage, but a lot of farm workers still struggle to reach healthcare or to receive healthcare service. And a number of health centers across the country still have problems reaching this specific population for a number of reasons. This slide includes the different struggles or barriers that may interfere with access to healthcare, specifically for farm worker families. As you can see, their work life might be a factor, transportation, income, language, health and digital literacy, as well as access to technology. And again, limited access to healthcare sites, especially for those in rural communities. And at times, some farm workers just don't know that there's health benefits available, or they're not familiar with community resources. So again, it impacts their ability to access care, as well as if they're concerned about immigration status or potential threats of deportation. So if a patient does not access healthcare, not only does it affect their physical health, but it can also impact their mental health. If a patient, including any farm worker, is living with fear and experiencing violence in some way, this can result in high levels of stress. Some mental health conditions associated with high levels of stress and domestic violence include anxiety, depression, substance use, and post-traumatic stress disorder. Women who are abused also suffer an increased risk of unplanned or early pregnancies and sexually transmitted diseases, including HIV and AIDS. As trauma victims, they're also at an increased risk of substance use. A US study found that women who experience partner abuse were 3 times more likely to have problems than non-abused women. Here's a quick snapshot of farm worker mental health. Among the farm workers and their family members who received healthcare services at migrant health centers in 2019, mental health disorders were one of the most commonly reported diagnoses. As you can see, anxiety, PTSD, substance use, and depression were found in segments of the population. Nationwide, agricultural workers actually report having low control of their jobs, but high physical demands, so that puts them at higher risk of experiencing depressive symptoms, in particular for Indigenous communities. Research suggests that Indigenous populations, especially Indigenous women, experience poor mental health and higher levels of stress than non-Indigenous Latinos. A lot of factors can impact farm worker mental health, aside from their agricultural work lifestyle. These are things to keep in mind, the ones that we mentioned that are challenges and barriers, because a lot of farm workers may also be immigrants or from other countries that have experienced or witnessed some sort of violence and have been displaced from their home and are exposed to other traumatic events as they make their way to the United States to seek work in agriculture. Now, I will transition to my co-presenter, Dr. Chang, who will speak more in detail about intimate partner violence and human trafficking, and how the psychological impact of these two experiences can have on a person's health.
Good afternoon, everyone, or good morning, wherever you may be. Thank you for having us here, Gladys and Sylvia. I am representing Health Partners on Intimate Partner Violence, IPV and Exploitation through Futures Without Violence, the National Training and Technical Assistance Partner on this issue. So let's review again, what is intimate partner violence? It's When one person in a relationship is using a pattern of methods and tactics to gain and maintain power and control over the other person, it's often a cycle that gets worse over time. It's not just one incident. Abusers can use jealousy, mental health, money, and other tactics to be controlling and abusive to the person, not just physical violence. We take a broader view of this issue, not just a criminal justice perspective on this issue. It can happen to anyone of any race, age, sexual orientation, religion, or gender. For any victim or perpetrator of domestic violence. It can happen to people who are married, living together, or who are dating. It affects people of all socioeconomic backgrounds and education levels. Let's go next to the trafficking, federal legal or legislative criminal definition. Under the Victims of Violence, Trafficking and Violence Protection Act of 2000, labor trafficking was defined as the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, peonage, debt bondage, or slavery. Again, this is a criminal legal definition. Next slide, please. It also defines the severe forms of sex trafficking as the recruitment, harboring, transportation, provision, or obtaining of a person for a commercial sex act through force, fraud, or coercion, or a commercial sex act in which the person is not yet 18 years of age. Remember that this is the criminal definition. So in healthcare, for the work that we do in our communities for our patients and our population's health, we look at human trafficking as with a broader lens of exploitation and sexual violence. So let's take a step back and look at sexual violence. Sexual violence includes rape, sexual assault, sexual harassment, non-consensual image sharing, and other types of child sexual assault and abuse that can occur. We look at it from a broader perspective because our goal in healthcare is to tend to our patients' experiences, whether or not they get access to the criminal justice system. Sexual exploitation is the actual or attempted abuse of a position of vulnerability, power, or trust for sexual purposes, including but not limited to profiting monetarily, socially, or politically from the sexual exchanges. So again, this is our public health and our healthcare perspective. We take a broader view because we are not criminal justice investigators. We're looking at our patients' experiences, many of which Gladys spoke about earlier in this presentation. Next slide, please. For labor trafficking, similar, we look at labor exploitation and labor violations. Labor exploitation is much broader. It is when an employer unfairly benefits from an employee's work. Labor exploitation is not a legal term. In fact, not all forms of labor exploitation are illegal. Next slide, please. And then labor violation is also within the rubric and framework of labor exploitation. This is a legal term, and it is used when employers violate federal, state, or municipal laws related to worker treatment, workplace safety, or record-keeping requirements. And then within that smaller bubble there in that purple, that would be the smaller subset of the criminal justice definition of labor trafficking. So just wanted to highlight that in healthcare, we take a broader view of sexual exploitation and labor exploitation for human trafficking. Next slide, please. Well, Gladys mentioned earlier about many of the harms and dynamics of exploitation and intimate partner violence or domestic violence. We want to highlight for you that for us, we think of it as intersected. There are similar or intersectional dynamics of these two issues, where there's physical and sexual violence, restrictions on freedom of movement, there's control. Remember the issues of power and control. There's isolation, there's financial isolation and control, there's intimidation and fear, and fostering oftentimes of drug and alcohol dependencies due to the patient's or the person's situation. In many federal trafficking prosecutions on the criminal justice side, it is not uncommon for the trafficker to be the husband, boyfriend, or romantic partner of the victim. Next slide, please. We want to emphasize that a couple of things in healthcare that you might not see physically presented in your healthcare settings are traumatic brain injury and strangulation. These are hidden, oftentimes hidden harms of intimate partner violence and exploitation or trafficking. Studies show that a range of 40 to 91% of women experiencing intimate partner violence have incurred a traumatic brain injury due to a physical assault. Think about that when you're talking with your patients. Next slide, please. Reproductive coercion is another important issue that is often used by perpetrators to control a victim. We won't get into that, but you can think about a lot of reproductive health harms and sexual health harms for the victims who are affected. Next slide, please. So think about, why might a survivor choose not to tell you, the healthcare provider or community health worker, not to tell you or disclose that they're victims of intimate partner violence or human trafficking exploitation? Why might they not share with a healthcare provider when they're screened or asked about this issue? There are many reasons for that, including shame, judgment, stigma, fears, threats by the perpetrator. There may also be fears of immigration impacts, fears of the police involvement, fears of law enforcement, fears that their children may be used or taken away by systems. They may lack awareness of their victim status and rights, particularly if they are immigrants or migrant farm workers to this country. They might not know the United States laws or regulations governing their industries or employment, and there are oftentimes language barriers and illiteracy. Next slide, please. So for us in healthcare, when we think about reaching out to patients and really finding out what their experiences are in the workplace or in their community or in their relationships, we must rethink screening. What does that mean? It means that screening is relying on a yes or no answer, on a disclosure from the patient. Screening in and of itself, by itself, contributes to health inequities because there are low disclosure rates. It is not survivor-centered. Resources and help are only offered based on a patient disclosing that they're in a situation of violence or exploitation. And there's a missed opportunity for prevention education. So at Futures Without Violence, next slide, and Health Partners on Intimate Partner Violence and Exploitation, we use and encourage and advocate for a universal education approach. What does this mean? Universal education provides an opportunity for clients or patients to make the connection between violence, health problems, and risk behaviors. It reaches out to and offers support to people who have never experienced intimate partner violence or human trafficking exploitation, to people and patients who are currently experiencing IPV or human trafficking exploitation, and people who may have a history or a lifetime history of IPV and human trafficking exploitation. So universal education means giving everybody and talking to everybody about these issues because it is so prevalent in our communities, as Gladys mentioned earlier in this presentation. Next slide, please. At Futures Without Violence, Health Partners on Intimate Partner Violence and Exploitation, we have developed tools and a framework to use that healthcare providers and community-based providers can use to reach patients with this universal education approach. It is an evidence-based safety card, brochure-based intervention. FUSE stands for confidentiality, universal education, empowerment, and support. You can see examples of these cards on the slide here. Next slide, please. So confidentiality, what does that mean? It means for us as doctors or nurse practitioners or physician's assistants or healthcare educators, it means we see our patients alone. And we disclose the limits of confidentiality, meaning when we must break them if they're at risk of harm to themselves or other people, or somebody else is causing them dire harm. Universal education and empowerment, it means normalizing this activity, making the connection, opening up the card and showing that there's a connection between what's going on in their work or in their relationships and their health, the symptoms that they're experiencing, the manifestations of their diseases. And then S stands for support, offering support and making sure that we as a system, healthcare and community-based organization partnerships, can offer support to these patients. Next slide, please. Here are some scripts for the confidentiality section. We always see patients alone. Before implementing cues in your health setting or health center, establish a clinic-wide policy that every patient is seen partially alone partially for every visit. Post a sign like this one in your waiting room and exam rooms that says, we have a clinic policy for privacy compliance. Every patient will be seen alone for some part of their visit. Thanks for your help. This way, providers can turn to this and show the patients that this happens for everybody. It's just part of our policy. Next slide, please. For disclosing the limits of confidentiality, you can say something like this. Before I get started, I want you to know that everything here is confidential, meaning I won't talk to anyone else about what is happening unless you tell me that you're being hurt physically or sexually by someone or planning to hurt yourself. Next slide, please. Here are some sample scripts for providing universal education related to intimate partner violence. I'm giving 2 of these cards, these safety cards, to all of my patients. They talk about relationships and how they affect our health. Take a look. I've also included one for you or a friend or a family member because we know this happens to many people within our communities. On the back of the card, there are resources you can call or text. You can always talk to me or any other providers here at our health center about how you think your relationships are affecting your health. Is any of this a part of your story? Next slide, please. Here's a sample script for universal education for human trafficking and exploitation. Many people are also feeling pressure around money and paying rent or bills. Sometimes others take advantage of people for work and also for sex. So we're sharing information about resources that are available. If you find yourself in a situation like this, or someone you know might benefit from this, can I give you unemployment resources, housing and food support, or other things to share if you or know someone who needs it? Next slide, please. And we really want to emphasize that disclosure is not the goal, but oftentimes when you have these conversations with patients, that disclosures do happen. It's vital, critical, really important that we respond to these disclosures appropriately and supportively. Next slide, please. So this comes to the S of cues, support. We recommend providing a warm referral. That means making connections with the domestic violence program in your local community or a human trafficking program within your local community, because it makes all the difference in the world. Sometimes patients can't use the phone or their cell phones because of the control and isolation pieces. So if you have a phone in your room, you can make that connection for them in the exam room yourself. If you like, I can put you on the phone right now with so-and-so or a local advocate, and they can help you to make a plan to be safer. Next slide, please. Now I'm going to turn it over to Monica Arenas from Futures Without Violence, who is going to talk about a new tool developed specifically and especially for farm workers, the Farmworker Safety Card tool. I think you will find this really useful in your settings, and thank you for being on the call.
Thank you, Dr. Chang. Good afternoon, good morning, everyone. This is Monica Arenas. So I will highlight a few resources that are available for your programs to use through the Health Partners on Intimate Partner Violence and Exploitation, a project of Futures Without Violence. So first, we will review a resource that was developed in collaboration with, or this resource that you have on your screen that this was the safety card that was developed in collaboration with Alianza Nacional de Campesinas, and as a tool for farm workers and professionals working with the community, including healthcare and community advocates and promotoras, titled No Estás Sola, Salud, Sanación y Relaciones Saludables, or You're Not Alone, Health, Healing, and Healthy Relationships. So this resource was put together in consultation with farm workers, leaders from around the country through listening sessions and direct review, and including the images and the content and language used. And so this card or information or pamphlet is a tool that can be used to support farm workers experiencing intimate partner violence, including exploitation. And it provides information on healthy and unhealthy relationships, impact on health, as well as COVID vaccinations and health center support, and also identifying people or friends that could provide support, as well as listings of national resources for support, and also a small space for communities and also your local resources to add your information there in the card. It's a small card, pocket size, that can be folded into 3 or 4, and then double-sided. And then also together with this card, we developed, to use this card in the next slide, please. We developed a resource information sheet to help in the use of this safety cards. So it's a 2-pager information sheet in English and Spanish that includes details on how to use the safety card with community and patients, and also information about the cues that Dr. Chang just reviewed. And also information about how to order the card, and also strategies on using the card. And this card can be ordered in packs of 100s and can be shipped to you for free. And the information sheet can also be ordered in pieces of 1 to 3 to 15. And so the information sheets can be both for the service providers, the promotoras, as a guide on how to use the safety cards with the community and also in the health centers. And also going back to the safety card, I think it's also can also be used by promotoras and others to help another friend who might need help as well, to provide support. And so I hope you can order this resource for you to use. And we're also happy to support if you have any questions about using this tool. And then in the next slide, please, we want to highlight a tool that can help also with building partnerships with community programs and health centers. So this is a template of a memorandum of understanding or collaborative agreement to help promote health and safety for patients and clients who have experienced domestic violence or intimate partner violence or human trafficking and exploitation. And the focus of this MOU is to promote bidirectional warm referrals for clients or patients between health centers and domestic violence programs. And then the next slide, we have a sample health center protocol that you can also use, a template that you can adapt also for health centers to formalize strategies to promote trauma-informed, survivor-centered care, intervention with clinical use and case management services, and also ways to connect patients with community-based services that provide the support for survivors. And also for employment assistance, housing, food, and legal assistance or other basic needs. And you're getting the links to these resources, and then we also have a document with a link to all of this, I believe. And so we want to also highlight, the benefits of creating partnerships between health centers and DV programs to support with health enrollment, helping establish a primary care provider for survivors and children with COVID testing, vaccinations, and home test distributions, and also to support DV programs to get with consultation on COVID during this time, and also child vaccinations, for example. And so we'll move to the next slide. Just wanted to highlight the website where all of these resources are housed, and at the Health Partners and Intimate Partner Violence and Exploitation website, led by Futures, especially to work with community health centers and to increase staff capacity for building or providing support for survivors and the community. And so in the next slide, we also want to highlight the importance of identifying resources in the community to support survivors, and also want to ask you, if you know your local program, you can write it in the chat. How are you connected with those programs? How are your partnerships going? So, this partnerships DV program can help you with supporting with immediate needs, basic needs, safety, housing, emergency, medical, food, clothes. And I see that we have a few advocates, so what it's important to reach out to healthcare providers to also let them know what your services are. And then also how you could build that partnership. Yes, there's a great relationship I'm seeing here. Yes, great. That's great to hear, to see that you already have relationships and partnerships. And so if you haven't formalized that partnership, I think you could also use these tools to help formalize those partnerships. And in the next slide, we have just a review, if you're not familiar with the national resources to support survivors, the National Domestic Violence Hotline, and then also National Sexual Assault Hotline. And that is available to support survivors and of domestic violence, sexual assault. And also in the next slide, we want to highlight also resources to support the rural farm workers and culturally specific support that is available, including Alianza Nacional de Campesinas, Esperanza United, that focuses on supporting or addressing the Latinx or Latina community, and community health workers as well. And also there's a directory of resources to support the immigrant community. And all of these resources are listed in a handout that you will receive. And the next slide includes other national resources, including the National Human Trafficking Resource Center, and also the National Runaway Safe Line, Strong Hearts Native Helpline, and the National ASL Hotline, American Sign Language, and Love is Respect. And I think I want to just go to the next slide and also highlight the importance of building community-based and relationships with community-based and culturally specific and faith-based programs, especially to support the farm worker community, because they are key in and can help support with possibly some of these programs can help with food, gas, includes medical assistance as well, or connections, language access, education and job skills, financial literacy, and culturally sensitive support. And I think I wanted to go to the chat, and then we'll go, oh, we have more announcements now that we wanted to share with you, but I wanted to just share, look at all the resources or connections that you're working with. Medical educator, Rochelle is sharing about at a domestic violence agency who facilitates trainings for healthcare providers. I'm glad this is helpful for you. Thank you for sharing, Rochelle. And then we have other resources here. Nancy, Sierra Community House provides these services in Truckee, California. Great. Thank you so much for sharing. And then now we want to share briefly about upcoming trainings here. In this slide, we have the upcoming training, and this is a learning collaborative that is a 4-week program for healthcare programs, as well as community and domestic violence, sexual assault programs, and anti-human trafficking programs. And this is taking place February 22nd through the March 15th. And it will include a lot of going more in depth on information that was covered in today's webinar. And also we have several co-sponsors, including Esperanza United and a program in Puerto Rico. And then and this will be done in Spanish with English translation or interpretation. And then the other upcoming program is we have a learning opportunity, another webinar addressing partner-inflicted brain injuries with a health equity lens, scheduled for January 31st. And also another webinar next week, January 23rd, on evidence-based and promising interventions to address the intersections of intimate partner violence and maternal health. And you will receive a handout with information on these 3 upcoming learning opportunities for you to register. So thank you so much. And we hope that you're able to participate and also use these resources. And I'll pass it over to Gladys.
Thank you, Monica. Yes, as we wrap up today's information, we also wanted to share a few resources from the National Center for Farmworker Health. I want to highlight our mental health resource hub. We have a lot of great information when talking about issues like domestic violence and intimate partner violence that can have an impact on mental health. We'd like to empower you and equip you with information, patient education materials, different resources that you can use to talk to your patients, including farm workers, about mental health and the impact of violence. So we encourage you to please check out our mental health hub so that you can download these resources and tools for your health center staff, for your outreach staff, so they're able to discuss any concerns for mental health conditions, can make referrals to mental health providers, and establish connections with some of the programs that are mentioned already by Monica and Dr. Chang, so that you can really inform and educate providers working with these types of patients. We also want to highlight information that we have available on COVID-19 and our Call for Health program. We have a lot of great resources for agricultural workers, as well as employers and farm workers serving organizations and health centers. So if you need more relevant information on COVID, we do encourage you to visit our website. And in particular, if you want to directly connect farm workers to their nearest health center, especially if they're needing some support for any incidents of violence or human trafficking. We encourage you to utilize our Call for Health program. This is a national lifeline program that connects farm workers to their nearest health center and can also offer some financial assistance, interpretation services, and different community referrals. So it's a great resources with bilingual specialists that are available to answer calls live. This slide captures all of the training and technical assistance available from the National Center for Farmworker Health. So we just wanted to highlight all of the information that we have on our website and encourage you to visit our website if you need any of these resources and information. This slide is just in Spanish with all of the same information we have at ncfh.org. And last but not least, NCFH is part of the Farmworker Health Network, and we work collaboratively to provide training and technical assistance to health centers with our partners listed here on the slide. So if you have any other needs that are specific to farm worker populations, we do encourage you to go to our website to learn more about the Farmworker Health Network and ways that any of our partners can be of support to you and your organization. So with that, we thank you for joining us today and provide our contact information here. I believe we are about to finish our recording and then transition for our live Q&A section. So if you're watching today's recording, we thank you for joining us. And if you have joined us live, then please stay tuned for our Q&A section here in a minute.